All right, all jokes aside, this is these glasses is distracting. It's your girl Shay in the building. Okay, this is actually a serious podcast. Like I might crack a joke or two, but this is really a dead ass serious one. I'm trying not to curse this much. I can't really help it. It's just in my nature. But tonight, I just want to really talk about health. Right? Health. Health is really important. Your family is really important. Um, your stability is really important, right? Um, my health, for a lot of you guys that don't know, I have type 2 diabetes. I have PCOS. I am morbidly obese, as they say. My BMI today was 57.1. That's extremely high for a 5'1" woman. Okay. My blood pressure was 148 over 80, and my sugar is now 6.2 A1C. Right? It was like 6.5 a couple months ago. They put me on Metformin again, and truthfully, I've been on and off Metformin for 8 years. I take myself off after feeling like really weird, like at work in the beginning, and then after a while, so being on it for too damn long, I get weird. Like my body starts feeling weird. I think the body it tells you like, okay, you've been on it a little bit too long, you know, don't up the dose. It's about time that you get rid of it because your numbers is okay. You know, I had a period in my life where I had lost a whole whopping 100 pounds just off of, one, leaving a toxic ass relationship, okay, that led me to overeat in the first fucking place, and then being on metformin, okay. I don't know if you guys can hear me, but this is as loud as I'm gonna get. Yes, being on metformin. When I was on metformin, in my early stages, it was interesting. I had to change from taking it in the morning to taking it at night because it makes you go to the bathroom, which is a good thing. However, my body became tolerant to it. Now I have to take something to actually go. You know what I'm saying? So I just been like drinking detox teas, drinking laxatives, and creating laxatives, and I just want my body to be natural. I have had some times when I've been on my healthy streak or whatever, with doing the shake out of sweat. I've been like, I'm on my journey. You probably see some videos of me working out with my boyfriend or whatever. Not actually me working out, but me walking with him or whatever. And I'm sweating or whatever, not knowing I'm out of breath. Okay. At that time, particular time, that's when I'm like, I'm choosing me. And like, I'm at the point where I just keep giving up. I mean, it's a lot of people on Facebook that I grew up around that knows me, knows that I get into the gym, I work out, I stop. You don't see me for months working out again. It's never really consistent with me working out. And I feel like because I'm 37, going on 38 next month, I'm knocking on 40. I need to be, you know, getting my health together, because it's scary that, like, I don't want to cry because I'm not looking for sympathy. It's real scary that you wake up, you can't really breathe, you get just a couple of steps on the stairs. I got like maybe 4 or 5 steps. I'm out of breath. Like I'm asthmatic or something. I can't get out of bed. I can't roll out of bed. Like I'm I don't watch the 600 pound life people or whatever, but I feel like I'm near, like I'm half that. I'm half that. I'm 303 pounds, 5'1". And I know it's like people are like, well, put the fork down, go and jog. People make so much fun of fat people, like you could just do that. It's not funny. It ain't funny. Especially in my situation. I have always dealt with like toxic relationships, right? And you would think it get better as I get older. You think you know a person, but you really, really don't. They just put this facade up, like they are your superhero and shit, and they turn out to be something that you don't want, but you love them. You know, you love them. You don't want nothing to happen to them, nothing. But you also hate them because how you feel mentally. There's no comfort. There's no safe space. It's like really scary, dark, and private. But in public, I put it like, how can I put it? It's beautiful because it's some things that I never experienced with nobody. And it's like, it feels like it's dreamy and deserving and all of that stuff that I post. And I never put the ugly truth because I used to put the ugly truth with my last one that lasted on and on 19 years. So, and I seen what it did. Like, people just judged me. Like, why are you still dealing with the motherfucker? I put a facade up too. I posted like I'm in this dreamy fairy tale lifestyle. But it's really scary. So that being said, I'm just speaking on the mental health part. Like, I suffer from like anxiety and depression and bipolar schizophrenia. It runs in my family on my mother's side. So bit of that is in there too. I've been in my head a lot, lately, especially being out of work. I've been on leave since April 12th. And I just been on standstill. I hate standing still. I love working, but I injured my back and they denied me workers' compensation, which is weird. Like, my doctor has me on leave for 3 months while I can heal and figure out my life. But this whole time I've been in the house, just in my head a lot and arguing and going back and forth. And I'm trying to focus. I want to get a restaurant up and running and do things and be positive and just live and have freedom and space and no judgments. I just be thinking crazy things like, do I deserve to be here? I just, a couple of days ago, 3 days straight, I had sat and it lasted till a couple of days ago. And I don't know if it was because it was my missus, like, am I going through menopause? Like midlife crisis, bitch. I was in the room for 3 days straight. I didn't get up. I didn't wash my ass. And I'm a big girl. You know, you ain't supposed to be with that girl. Like, all I did was cook and eat and cook and eat, watch TV and be in my phone all day and just be in my head all day too at the same time. I mean, the devil be playing with me, honey. He really be playing with me. Like he says, I'm a bad mother because my son is staying back for another time. Like this is his. It would be his third time in the fucking first grade. They just can't get it together. My son. Crazy part, my oldest, she stayed back in the third grade, and at that time I thought I was a bad mother too. They just learn differently. They learn differently, and I don't put in enough effort. I can't afford a tutor right now, but I don't put in enough effort. I mean, my boyfriend occasionally he helps out with his homework, but I have anxiety, and the way he teaches is gives me anxiety. But my son gets it, and I'm like, that's what you need. You need someone to constantly keep yelling at you and force you to just like I don't know. It's just it gets to me. I guess I'm too sensitive sometimes when it comes to my kids, especially my son, because that's my only boy. But yeah, my girls losing their virginity the way they did, without coming to me as a mother and a daughter, having a bond with me, that got to me. Just everything just started playing on me. I'm a grandmother. I'm 37 years old. I'm a grandmother. It's crazy. Like, I know God is like, there's no rule book. There's no fucking rule books to life or parenting. Yes, it's the Bible, but we're at will with things. So I shouldn't be crying. I shouldn't be up here on this platform telling my business, but it is what it is. This is my only safe place to have it. Sometimes I feel like it's not even safe enough, but I was going to seek therapy. I went to the doctors and I was going to ask my doctor for therapy, but it seemed like I don't know if it's the Trump situation, but I've been treated like shit. Let me tell you something. Let me sidebar. Since Trump came up in this mug, or right before Trump came up in here, I'm gonna tell you, I kind of feel like I've been treated like shit because by white people. I have never really experienced much of nothing since the last time he was up in this mug. Okay, I never, of all the presidencies, I never experienced racism until he got up in here. The first two times was in Pennsylvania, and I was called a nigger twice. At first, I thought it was funny because I was dropping off somebody's boyfriend doing Uber, and the lady was drunk. And she was like, some nigga, whatever, whatever, whatever. And I thought she was thinking that she was like trying to get me to feel some type of way. Like, if I was one of those, I would have ran her ass over, hands down. Hello. But I thought it was funny, so I drove off. Let me get the fuck out of here because let me turn this app off too and put this back to my area. The second time is when I was doing Uber and he had got basically elected, right? And yeah, he got up in there, and there was a white couple in the car with me, and we was talking about politics. I don't talk about politics, but they were talking about politics. They were so gung ho to talk about it, so we just talked about it. I gave them a neutral answer. I wasn't trying to go there just in case. Bitch, I want your money. I don't want you to give me no bad ratings. So I was very neutral to the situation. I'm in between a car. I'm in between two cars. There was a car in front of me, and I was in the middle. There's a car in the back that's like rushing, and I can't do nothing about it. I'm about to turn right, and this person wants to go straight. This person, we're talking. They started going, and they started talking about Trump. The person in the back, get your fucking nigger ass out of here, nigger, get your nigger ass out of here. And I'm like I was stunned. Like, are you serious? I can't go nowhere. I'm in between cars. Like, are you serious? What, you gonna ram me over? Like, you gonna ram me? And these people, I heard as loud as hell. And these people just kept talking about Trump as if they didn't hear, like it's normal for them. I couldn't even talk no more. I just started crying when I dropped them off, and I know they felt it. I couldn't do it. But this time, now he's back into it. My first encounter was with the dentist. Her name was Karen, ironically, because there's a lot of Karens out here, but this had to be with Karen. Her name was Karen, and she was my dentist. Lord, when I got in that damn table, everything was fine until she got the flosser thingy, little curve thing. I don't know what it's called. Cleaning my teeth. She didn't numb me or nothing. Nothing. She gave me cleaning, put it in my cavities. And, as soon as she asked me, who did you vote for? I said, I looked right at her like, because I know that's not professional. You're not supposed to talk about politics. She won't talk about politics. Whew, I'm black, you're white, and you're older, so I know you voted for Trump. I was like, yeah, I voted for Harris. She was like, is there a particular reason why you voted for Harris? I said, I just didn't want to vote for Trump. I can't deal with Trump. She's like, So when she got in her teeth, she started. Then she nicked my gums too, on accident. I was in pain. Nah, that could have been a lawsuit, but how could I prove it? I got clean teeth. It was a treatment. It's just he kept talking about like I know a lot of people don't like him because of the way he says things and he's this, he's that, but he's just gonna clean it up, clean up America. A lot of people don't know that Barack Obama got a lot of immigrants and this and that, and that all this stuff, and I'm like, mm-hmm, mm-hmm. I just want you to get your ass out of my mouth because you're doing too much. That was that time. Now, recently, like I said, with Amazon, I injured my back. I went to the doctor, or I went to the doctor for something else. I went to the doctor for my hip and my knee because back in the day, I was busting it down and I fucked my knee up. My hip up. And over time, that my right knee on the right side of my hip, right, they started connecting right along with my right foot. Everything just. So when they did the X-ray, they seen at the bottom of the X-ray that my back is like it says degenerative, right? So that means like I've got a little arthritis in my back. Baby, I got a little arthritis a little bit everywhere. In my back, my shoulders, my knees, feet, you name it. And it's like all the doctors ever say is your weight, your weight, your weight, your weight, your weight, your weight. Even the GYN, your weight, your weight, your weight, your weight. So, I don't know. I was supposed to go to work on the 12th. I couldn't get up out of bed. I was stiff as fuck. And then when I got up, I was like, nope, I gotta call out. And I called all the way out. And I went to urgent care. And when I was at urgent care, I then had to go see my doctors or whatever, and they scheduled me, um, the spine doctor and stuff. So and it went from there. Then I did workers comp, and they denied me because basically they said I had some pre-existing injuries or whatever that could basically had could have led to my back injury and stuff. And I'm like, no, bitch, that shit came from picking and pivoting them damn heavy ass boxes or whatever. They gave me one check and that was that. That's fine. That's fine. But my thing is, I'm not about to come back to Amazon. It's not even so much about the money, bro. For real, it's really not. It's more about like my back is fucked up. I can't work at Amazon, and I can't really stand too long either. So it's like I'm a little fucked up. Somebody got to pay for this shit, right? And it's only me. When I went to the doctors for all of this, the spine doctor, I didn't even do a full X-ray yet for my back, so she don't even know what the fuck, right? I got denied workers' comp before I can see a spine doctor. I see a spine doctor. She says no restrictions before seeing an X-ray, and I'm like, are you kidding me right now? I go to see my doctor. She was all right, but I'm asking her questions about thyroids and everything else. She's just guessing. They found something in my lungs when they did my X-ray for my back. You know, it was, basically they found something doing the X-ray, and that I need to go see a pulmonary doctor. My doctor tells me, oh, you know, basically talks about what they found on the spine. And I had to bring it up. Okay, but they said they seen something on my lungs. And she said, oh, well, if you don't have any breathing problems or anything like that, I wouldn't worry about that. Bitch, what if I got lung cancer? Like little specks of lung cancer. Or if I got inflammation that can be cleared up with an antibiotic. Or just obstruction of some fluid or whatever. Like I got walking pneumonia or some shit. Or asthma or edema or hell. Anything. All these doctors white. And I'm like, where's my black people at? I don't have no black doctors. Like, I can't request a black doctor or I can't request a female doctor. Like I just was like, I felt like I was just handed some kind of way. Like, I don't know. And I don't know, like, with this whole DEI thing, I don't know if it had anything to do with it. It's just, I started feeling in my inches, like, I could be fucking dying and I don't know. Like, 'cause these motherfuckers won't be handling me right. I'm looking at my x-ray. I don't know what the fuck I'm looking at. But I'm comparing it to other x-rays and it's just like, it just don't look good. All my doctor says is that you just need to lose your weight. Bitch, I know. Because the x-ray said that I had too much fat around my spine that they couldn't even see. Too much of anything. It just says inflammation. There's a lot that actually it said a lot. anthropathy, sclerosis, generative, some other shit. I thought it said scoliosis, bitch. I was like, no wonder I've been going to the side. No offense to anybody. I'm like, no wonder I go to the side like this. Like, for everything's leaning to the right. I'm like, I need a body alignment just like my car need a wheel alignment. But like, yo, my doctor put me on iron pills a while ago when I first went to the doctor in January. She put me on the Metformin for the sugar. She put me on vitamin D. You know, 'cause my vitamin D was real low. I'm anemic as well. Like, it's like a lot of shit going on. But you know what? It's what you put in your body. And it's what I've been putting in my body for years. Processed foods, dairy products, unhealthy meat. You know, I like the flavor. I love flavor. I love feeding my cravings. And when I'm emotional, I definitely like to eat. You know, and then, just like I said, it runs in the family. I don't know if that's genetics or what, but like my mom saw this big bone. Okay. They had their time when they were small. But we all big, including my uncle. He a big bone motherfucker. I'm just like, I'm acknowledging that I do need to lose the weight. I need to lose the weight. I need to lose the weight. I need to lose the weight. And I've been paying my gym membership since 22, every month faithfully, 25, 35, Planet Fitness. And ask me how many times I went. Yeah, okay. I just ain't been in the mood to go. I really had a time in my life where I used to be like focused on me working, of course, especially working. I definitely had a time when. See, my problem is I'm so used to working like a nigga, my father, that the minute I have to sit down, I'm in like panic mode because like what am I going to do for income? What am I going to do? You know, for my sanity, because work is my safe place. Like I can just work it through and be thinking, you know, about the positive part of it, and I'll be good. You know, it's just I get through it because I'm consistently doing something. But when I'm in this house with no color on the wall, I look like I'm in an institution. I feel institutionalized. Ain't no sun coming in this house or nothing. I'm like easily depressed. Everything start getting to me. And when I get outside, bitch, I'm like have a little like anxiety attacks on the low because I'm like I ain't been outside in a minute. Everything's starting to, you know, I get real like antsy and I jump in and I get scared because I think my son gonna get hit by a car. Or, like everything gets to me so easily. Like, and I'm like, yo, just calm down, calm down, and don't let me get upset. I'm automatically spending my savings on some food. Definitely gonna do that. I got all the knowledge in the world when it comes to losing weight. I got equipment in my closet. I got dumbbells. I got medicine balls. I got yoga mats, jump rope. I make and sell sweat oil for working out, bitch. Like I got everything. I got a let me get this domesticated juicer, whatever. I have a regular juicer. I have a NutriBullet. I have the fruits. I have the vegetables. I have a water dispenser. But what I don't got is me. I don't have me. I don't have the girl back in the day who was motivated in a healthy space, in a healthy place, bruh. I don't have her. I don't have her. Like, where did you go, bro? I need you back. And I caught myself fasting for 21 days. That worked. I lost some weight, but I broke my fast a lot of times. And I know God knows my heart, but I don't want to go fast again because I need to get closer to God. It's like something about getting connected to God is like it's like a breath of fucking fresh air. I don't know if anybody understand that. It's like you just need him to touch you for real. And this is not like me pulling words from books or sayings from other people who said this shit. This is some real shit. You know, when you fast or you just pay attention to God and He touch you, it's like a breath of fresh air. I came this far with God. I just have to have faith in me, faith in God, faith in my surroundings, faith in the universe that the universe got my back. But you know one thing I am afraid of? Retrograde. Because it's in every other fucking July I go through it. And this year it's seemingly to be the year. But I don't want to go through it in a major way. I want to go through something where I come out as positive all the way around. I mean, everything comes out positive after you go through a storm, but still. So I came up here. I didn't expect to be emotional right off the bat, but just want to tell you guys my journey. And I need your prayers. It has come to this that after all these years of in and out of relationships and not really paying attention to your health and gaining the weight, damn near feeling like you about to die, heart palpitations, heart problems, fucking like all kinds of shit, yo. It's like you're not losing the weight, you're not focused, you're not nothing. It has come to this. I've been advised to get this fucking surgery mega times. I'm not doing that surgery. I'll get the surgery to get these fucking fibroids out for real, because these fibroids are growing for real. It's starting to become I got a big stomach already. So when I get my period, that shit, it bulge out. It's swollen like a something that's going on down there. That shit my uterus be hard and tight. And they talking about getting a hysterectomy. And I'm like, nah, I don't want no hysterectomy, baby. I don't want no more kids, but then I just don't want to get a hysterectomy because I want to feel like a woman. I want to still get a period. I already got the fucking hair, and now I don't get no damn period. Come on now, I don't. I'm good on that. But like anything to save me from getting uterine cancer, whatever, you know what I mean? Because my mother, she died from uterine cancer. I was a miracle baby, so I was not supposed to be born. They were supposed to abort me because my mother got all these abortions and miscarriages and, solid scar tissues and stuff like that. She had fibroids, and when she had me, she said she had a whole 9 months of painful shit. And I was like, damn, that's crazy. Never took it serious though. I just was like, Wow, that's crazy. Your kids don't know what you go through until they go through it. So I was a kid. I didn't know nothing about the uterine cancer or whatever. I didn't know nothing about that. I didn't know it would take her out either. So it's like when the doctor advised you to get a hysterectomy, and I'm looking like, my uterus. Like I don't know, I'm listening to the media, but I need to be listening to my doctor. My doctor knows me best. I don't want to have to go through a situation and I gotta get an emergency um, hysterectomy or some shit like that. You know what I mean? I don't want to go through that. But this uterine stuff, I done had surgery on a hernia that I didn't know I had. I got my gallbladder removed. I had 3 cesareans. I had a tag on my ass in the inside of my ass that got removed, and another one grew. Um, what else? Yeah, I mean, my body went through some stuff, going up and down with the weight. I was 176. I was two something, three something, back almost four something, back down to two something. Now I'm back up to 300. My heart is like, girl, too much. People say you could die from that. Yeah, I think I feel it. I can feel it. I don't want to die, but I don't have family members and nobody telling me either. I don't got really nobody other than my man. He loves big girls, but I ain't trying to die to stay a big girl. I want to be thick, petite, short. Of course. But let me tell you something. I have a cheat sheet, and it has come to this on an ice pack. Okay, it has come to this. I'm fucking petrified. I'm petrified. So I have to take the way my doctor got it. I have 6 milliliters of Ozempic. So I have to take 4 0.2 25 milligrams. 0.25 milligrams. Okay. Every week for 4 weeks. Then after that is 0.5 milligrams. Okay. For 4 weeks. Another 4 weeks. Someone's at Ozempic for 2 whole months. 2 whole months. It is going to be challenging because it's only me. My daughter is against it. Well, my middle child, she's the liberal. She's like against a lot of stuff. She's for and against a lot of stuff. So my boyfriend, he's definitely against it. I asked him if he could do me a shot on my leg or my stomach, and he said he don't want no parts of it. He don't want no involvements with it. And I'm like, 1 minute I'm thinking like, we talked about this, and I said I would get the shot, and he was like, oh okay, like there was nothing right in the beginning. When I get it, and it's almost given that I'm gonna lose the weight, people gonna be on me. He's already on me. and I look like this. I'm not self shaming myself or, have low self esteem. It's just that I'm not well put as is. Like I have a lot going on in a negative way that I'm not even proud of. Okay, and I still get stared at. I still get talked to. So if I lose weight and I look good, back like wow, I used to, thick, boom, 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 it's gonna be worse. I don't want an insecure, jealous man. It's gonna be far fucking worse. To see it now. But then the other side is like, say you don't want to no parts of what I'm doing. Like I'm not gonna stick a person to death. Like I'm not gonna be involved with that. Like he's like, I'm not gonna be the one to kill you. Some shit like that. I'm not. I'm ad libbing, and I'm like, what do you mean? Like what these people, what it's doing to these people? I don't see what they're doing, what it's doing to anybody. I don't know who died from Ozempic. I think like because one, you have to stay hydrated. That's number one, and you have to eat healthy. You still got to work out. You got to find energy from some kind of somewhere or whatever. You have to regularly live a healthy lifestyle after this. So choose me now. Like I want this now, and I'm choosing me now. I want your support. I want everyone's support. You know, accountability partner of anything. Like if you see me eating stuff I'm not supposed to be eating, slap that shit out my hand. I'm gonna cry like a bitch. I probably want to fight. But tell me that, say something harsh. Like you don't want to die, right? So I could just say something stupid. I probably say something dumb. When I'm mad as hell, I probably say something stupid like, "Yeah, I do," because I'm mad. I want my burger or some shit. Like, so it's just me and YouTube. Everyone knows in this house, but I haven't posted on Facebook yet. I ain't get there yet, but it's just us. Like I want to get my breathing right. I want to get my walk right. I want to get my stance right. Like I want to get my gear right because I can't fit nothing, nothing, bro. I had to throw away hella clothes. One that I couldn't fit, and the ones that I could fit, I wore them down, bro. I wear sweats or work clothes all day. So imagine I'm wearing the same sports bra all the time. I don't wear underwear unless I got my misses, but that's a truth. I mean, she be fresh, she be fresh. But the pants, they back and forth, back and forth, and then created holes in the middle, so I had to throw them away. Workout clothes, I'm not there working out, but I wore them all the way till they got splits down in the middle. I'm ready to get back into the clothes that I bought with the tags on it. I still got clothes that got tags on it that I just packed up. So I'm praying that I know this man-made drug works and that I don't have to deal with anything that adds on to the list of problems. I want to eliminate the list, especially the diabetes, because I don't want to be amputated by no means. Like I don't. I want all my limbs, all my everything. I want every part of me to work. I don't want to have a circulation problem. I don't want no arthritis, even though arthritis is no real cure. You just can just manage it. Because my hand get crimped up. I know I got arthritis everywhere because my hand get crimped up. That shit lock up on me. Bones be aching. I be aching when the weather's bad. Come on now, I'm 37 years old. Don't be going through it. So, the worst part about this though, like I keep putting my glasses on because I can't see. I got a diabetic eye exam coming up. I don't like this. This is not supposed to be my life. But if you don't take care of yourself, it's gonna be your life. It's so many stuff like let me just tell you the bullshit that I'm about to put in my body. I'm still like self conscious about it because although I haven't heard any negative feedback about Ozempic, I just pray to God that Ozempic don't be one of the drugs later on uh in what you call it in the scare. Like if you ever been on the Ozempic, you may have a lawsuit. Like, I don't want to deal with that. Is there a lawsuit for Ozempic? In fact, hold on before I even stick myself. Hold on, let me ask my girl because it's my girl. Is there a lawsuit going on for Ozempic?
Yes, there are ongoing lawsuits concerning Ozempic. People across the United States have filed lawsuits against Novo Nordisk, the manufacturer of Ozempic, alleging that the drug caused them to suffer serious health consequences and that the company failed to adequately warn patients and doctors about these risks. It is expected that thousands of additional lawsuits may be filed in the coming months. These lawsuits are not yet class action lawsuits, but rather individual lawsuits that have been consolidated into a multi-district litigation, MDL, in the Eastern District of Pennsylvania. An MDL streamlines the judicial process for cases with similar factual allegations. As of May 1st, 2025, there were 1,809 such lawsuits pending. The primary allegations in these lawsuits involve severe gastrointestinal issues, including gastroparesis, stomach paralysis, a condition where the stomach muscles weaken, preventing proper digestion, ileus and bowel obstruction, blockages in the intestines, cyclic vomiting syndrome, episodes of severe nausea and vomiting. More recently, lawsuits have also begun to include allegations of other serious side effects, such as non-arteritic anterior ischemic optic neuropathy, NAION, a condition causing sudden and permanent blindness,
Oh my
gallbladder
god.
problems, including inflammation in gallstones, pancreatitis, inflammation of the pancreas, deep vein thrombosis, DVT, and pulmonary embolism, PE, blood clots, suicidal ideation, reports of suicidal thoughts in individuals taking GLP-1 receptor agonists like Ozempic, malnutrition and dehydration, resulting from severe vomiting and diarrhea, pulmonary aspiration, inhaling stomach contents into the lungs, particularly during anesthesia or surgery. The lawsuits claim that Novo Nordisk knew or should have known about these risks, but failed to provide adequate warnings to patients and the medical community. Plaintiffs are seeking compensation for medical expenses, lost wages, pain and suffering, and other damages. It is important to note that these are allegations at this stage, and no settlements or judgments have been reached in the Ozempic litigation as of yet. The legal process is ongoing, and the outcome of these lawsuits remains to be seen.
Thank you, girl. Oh, what's crazy about what you just heard, right? Like ever since because I went to the doctor yesterday. So day before yesterday, I already knew that I was gonna get the shot. Now I didn't know my insurance was going to pay for the shots. I thought that it would have to come out of pocket like 150 or something like that a week or some shit until it's paid in full, right? My thing was And then being that I had Medicaid, that they was gonna give me the generic version, like they was gonna give me the GLP one or some shit like that, or semaglutide by itself, not Ozempic, because Ozempic at one point was high as hell, and nobody can get it. Now, with me having so many health complications, and they rather pay for something like Ozempic versus me going to get the shot. I mean, going to get surgery. And I'm like, I don't have an issue with some of the things that it was said, like gastro, whatever. Like, okay, so metformin, that there's some similar stuff like with metformin, right? That's why I said when they seen something in my lung for the I mean, during the X-ray, that comes from the medication, right? I knew to stop taking it because obviously my body tells me that I'm going through some shit. Sometimes I don't listen, but I'm just saying. And for them to just give me something like Ozempic, it's like a little strange for me. So I feel like that's another thing I wanted to go get at. It's like the way I'm just handled. So I bring it back. Like I said, 2 days ago, on the 7th, I just kept like all these different signs out of nowhere about health and dying and all kinds of stuff, right? Like, just why is it like this? Why is all of a sudden I'm about to go to the doctor? I just, all these different things coming up about health and conditions and what could happen, and me being on the operating table, that was in my mind. But like, what the fuck? Like, let me tell you something. Not showing my address. Right, look at this shit. Can you see that price? That price. Final due. I didn't have to pay shit. This shit right here is $2,397.70 for the official tissue. For the official tissue, okay, the official tissue. As soon as I get it, as soon as I get it, all kinds of shit's happening. All kinds of shit's happening. And I don't know about nothing about no blood clots and all of that stuff, but like with any medication, I feel like you're still supposed to have a healthy diet. You're supposed to have number one, faith in God, as always. Okay? 100%. Let them walk you through that whole journey. Two, a healthy diet. Okay? You have to stay active, have to have a healthy diet. You got to keep moving. Three, number one, that should be number one, staying hydrated. Get you a water bottle or 3 or 4 and keep drinking all day long. No matter whatever you're going through, dehydration or whatever. I'm a firm believer of stretching some shit out. Okay. Metformin was supposed to be taken every day from the time she gave it to me to now. So regulate my sugar. But because I know what it feels like, the symptoms, I took myself off of that shit. And people, my last doctor before her used to say, why would you take yourself off? That's not how that works. How can anything be effective if you keep taking yourself off? Why would you want to keep me on? So you could put me on something else and something else, something. No, this is only for me to be on something temporarily. If it don't work for a certain amount of time, then take yourself the fuck off. Or do an alternative fix, like Dr. Sebi say, and get healthy with earth, the earth way. I don't want to be up here the next time and say I'm now drinking soursop, trying to get rid of cancer. You know what I mean? I'm going to get rid of whatever toxins is in my body, Without me adding all this shit into my body just for me to shrink a little bit, that's a little extreme. And I just made my insurance pay for it. Just like the damn doctor for my back gave me some I didn't know, never heard of shit before. What the hell is it? Prednisone or some shit that's supposed to be a steroid for your back, but that shit comes with complication. I mean, that shit worse than what you just heard. I gotta go, if I can find the paperwork. I don't want to be on pills for the rest of my life, bro. I don't want to be on nothing for the rest of my life. All I want to be on is the water, fruit, vegetables, and air, bitch. Okay, like berries and shit. Let me be on a Daniel fast again. I know I'm gonna lose that motherfucker weight 21 days too. And to be honest with you, he didn't really, he didn't fast for 21 days. I think. Okay, so he did there wasn't an actual 10-day fast, was there? Oh wait, no, it was a 10-day fast. It was a 10-day fast. I think it was actually 7, but it was a 10-day fast. Then he did a 21-day fast. So, but this was not about him getting his visions. Well, the second time he needed to get his visions. The first time it was trying to make them a believer. Yes. Hell, this could be cancerous. I don't know. All I know is everything that we consume in our bodies, the air we breathe, the water we wash our ass with, to drink, that contaminated shit. It's all kinds of stuff. But we need to learn how to get the toxins out of our body. But let me tell you, Seglumitide, pre-filled pens, Ozempic, okay, semaglutide or whatever, okay, product dispense, okay, 0.25 or 0.5 subcutaneous solution pen inject. Okay, don't mind me. Let me tell you this part. This is all the way in the back of the paper. I ain't even get to the front. It says this drug has been shown to cause thyroid cancer in some animals. I think I read this already. See, I don't memory. It is not known if this happens in humans. If thyroid cancer happens, it may be deadly. If not found and treated early, call your doctor right away. If you have a neck bass, trouble breathing, trouble swallowing, or have hoarseness, that will go away. Do not use this drug if you have had health problems called multiple endocrine neoplasia syndrome type 2, or if you or a family member have had thyroid cancer. Have your blood work checked and thyroid ultrasounds as you have been told by your doctor. I done got my thyroid checked out already, and she said my thyroid is fine. I don't know what they look like or whatever, but I'm not hoarse or nothing. But my glands is like swollen. You know, this area is like thick, 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 thick. I really don't know what thyroid looks like, but it would be really scary. I start taking this, and then I start sounding like a man. I already got this. Okay, I don't want to sound like a damn man or have cancer. I don't want to go through that. I really don't. It says, what is this drug used for? It is to help control blood sugar in people with type 2 diabetes. Hello. It is used to lower the chance of heart attack, stroke, and death in people with type 2 diabetes and heart disease. It is used to lower the chance of worsening kidney problems and death from heart problems in people with type 2 diabetes and kidney problems. What do I need to tell my doctor before I take this drug? If you are allergic to this drug, any part of this drug, or any other drugs, foods, or substances, tell your doctor about the allergy and what signs you had. If you have ever had pancreatitis, I would never know because I have to go to the doctors all the time, and they never said nothing about my current pancreas. If you have a slow moving bowel tract, if you have a slow moving bowel tract or other stomach or bowel problems, I can't shit unless I take something. Okay. If you have ever had depression or thoughts of suicide, I should have stopped right there because yeah, I I don't have thoughts of suicide, but I have negative thoughts. I suffer from depression all the time. If you are taking another drug that has the same drug in it, if you are using another drug like this one, if you are not sure, ask your doctor or pharmacist. If you have if you have type 1 diabetes, do not use this drug to treat type 1 diabetes. This is not a list of all drugs or health problems that interact with this drug. Tell your doctor or pharmacist about all of the drugs, prescriptions, or OTC, natural products, vitamins, and health problems. You must check to make sure that it is safe for you to take this drug with all of your drugs and health problems. Do not start, stop, or change the dose of any drug without checking with your doctor. What are some things I need to know or do while I take this drug? Tell Tell all your healthcare providers that you take this drug. This includes your doctors, nurses, pharmacists, and dentists. Follow the diet and exercise plan that your doctor told you about, which never gave. Okay, talk to your doctor before you drink alcohol. Mm. If you will have any surgery or procedure that uses anesthesia or deep sedation, talk with your doctor. This drug may raise the risk of food getting into your lungs during the type of surgery or other procedures. This drug may prevent other drugs taken by mouth from getting into the body. If you take other drugs by mouth, you may need to take them at some other time than this drug. Kidney problems have happened. Sometimes these may need to be treated in the hospital with dialysis. If you cannot drink liquids by mouth, or if you have upset stomach, throwing up, or diarrhea, that does not go away. You need to avoid getting dehydrated. Contact your doctor to find out what to do. Dehydrations may lead to low blood pressure or to new or worsen kidney problems. Do not share pen or cartridges devices with another person, even if the needle has been changed. Sharing this device Sharing these devices may pass infections from one person to another. This includes infections you may not know you have. If you are planning on getting pregnant, okay, skip. Where disease medical alert what the fuck? Check your blood sugar as you have been told by your doctor. Don't have a device to do that. And it just shit go on and on and on. And this is the front and back kind of shit. Do not drive if your blood sugar has been low. I have actually had a episode one time, and I don't know if it was due to I forgot what that shit called. It was some milky shit, and I had something with vinegar in it, and I forgot I had drunk the milky stuff, and I had drunk that vinegar shot. I was on the highway, and next thing you know, I started palpitating. Body started getting clammy everywhere. Literally, basically, was about to pass out on the highway. I couldn't say anymore. I was like, I just was, I was about to go out, honey. My sugar was super low. That was the first time I ever crashed like that. Um, yep, do not drive when your blood sugar has been low. There is a greater chance of you having a crash. People taking this drug with other drugs for diabetes may have a raised risk of low blood sugar. Very low blood sugar can lead to seizures, passing out, long lasting brain damages, and sometimes death. Talk with your doctor. It may be harder to control blood sugar during times of stress, such as fever, infection, injury, or surgery. A change in physical activity, exercise, or diet may also affect blood sugar. Tell your doctor if you are pregnant. Skip. What are some side effects that I need to call my doctor right away? Like, it just keep going. So I'm gonna just read. Let me see. Warning cautions. Even though it may be rare, some people may have very bad and sometimes deadly side effects when taking a drug. Or taking a drug. They didn't say about this drug. Signs of allergic reaction like rash, hives, itching, red, swollen, blistered, or peeling skin with or without fever, wheezing, tightness in the chest or throat, trouble breathing, swelling, swollen or talking, unusual hoarseness, or swelling of the mouth, face, lips, tongue, or throat. Signs of kidney problems like unable to pass urine, change in how much urine is passed, blood in the urine, or a big weight gain. Okay, signs of gallbladder problems like pain in the upper right belly area. My gallbladder got removed. Right shoulder area, or between the shoulder blades. Change in stools, dark urine or yellow skin, eyes, fever chills, very bad dizziness and passing out. A fast heartbreak, heartbeat, change in eyesight, low blood sugar can happen. The chance may be raised when the drug is used with other drugs for diabetes. Signs of maybe dizziness, headache, feeling sleepy or weak, shaking, fast heartbreak. Why are you saying heartbreak? Heartbeat, confusion, hunger, or sweating. Call your doctor right away if you have any of these signs. Follow what you have been told to do for low blood sugar. This may include taking glucose tablets, liquid glucose, or some fruit juice. Yes, ma'am, or some bread or potatoes or something. Potatoes and juice is the fastest. Severe or sometimes deadly pancreas problems, pancreatitis, have happened with the drug. Call your doctor right away if you have severe stomach pain, severe back pain, or severe upset stomach or throwing up. Severe stomach problems have happened with this drug. Call your doctor right away if you have stomach problems that are severe or do not go away. Side effects. So the main thing is constipation, diarrhea, stomach pain, upset stomach, or throwing up. Now, all of these comes with medication. Metformin was definitely on the Metformin lately has been on the constipation side. Before it used to be having me shit like crazy. um and now it just make my stomach feel weird. I hope I don't have like gastritis or anything. How is this drug being taken? It is given as a shot into the fatty part of the skin on the top of the thigh, belly area, or upper arm. I kind of do want to put it on my upper arm. If you if you will be giving yourself the shot, your doctor and nurse will teach you how to give the shot. Bitch ain't give me shit. Take with or without food. Take the same day each week. Move the site where you give the shot with each shot. Do not use if the solution is cloudy, leaking, or have particles. This drug is clear and colorless. Do not use if the solution changes color. Wash your hands before and after use. Remove all pen needle covers before injecting a dose. There may be two. If you are not sure what type of pen needle you have or how to use, Talk with the doctor. Keep taking this drug as you have been told by your doctor or healthcare provider, even if you feel well. Attach new needles before each dose. Take off the needle after each shot. Do not store this device with the needle on it. Throw away needles in a needle shot disposal box. Do not reuse needles or others. When the box is full, follow all local rules for getting rid of it. Talk with your doctor or pharmacist if you have any questions. Now, my thing is, see how I'm saying I feel like I've been dealt like this any kind of way. Like I never administered a shot in my arm before or anywhere in my body before. My boyfriend has. He did it with his mother, but he doesn't want to participate with this with this shenanigans, as you say. You know, I'm doing this for me, but it is a little scary to have all these complications beforehand, warning signs and stuff. And it's like saying, like, bitch, we done gave you all these warnings and you still want to do it. If you do it, that's on you. That's the scary part. Like, I done got the prednisone from the doctor. Shit still sitting on the shelf. I done got the metformin, then turn around to get another dose of metformin. It's just sitting in the bag. Now I got this Ozempic, and it's like, do I want to take the full dose? Can I just take 0.25 this week, and then 2 weeks from now, I do another 0.25, then another, you know what I mean? Like, I want to stretch it out. I don't want to do it too fast, like everybody else do. And then I already look old. I'm 37. I don't want to look like I'm 70 years old. Okay. Take a missed dose as soon as you think about it and go back to your normal time. If it is less than 48 hours until your next dose, skip the miss and go back to your normal time. Do not take two doses within 48 hours. How do I store and throw out this drug? Store unopened pens in a refrigerator. Do not freeze. Do not use if it has been frozen. After opening, store in the refrigerator or at room temperature. Throw away any part not used after 56 days. 56 days, so I'm sorry. Can I just lose weight by myself? Can I just gain the courage? Just do it. I'm wasting these white people money. If your symptoms or health problems do not get better, or if they become worse, call your doctor. Do not share your drugs. Okay. This generalized information is limited summary or diagnosis treatment medication. It is not meant to be comprehensive and should be used as a tool to help the user understand and assess potential diagnostic treatment and treatment options. It does not include all information about condition treatments, medication side effects, crazy child, or risks that may apply to a specific patient. It is not intended to be medical advice or a substitute for medical advice. Okay, they made sure to give us these little disclaimer thingies here. All right, Ozempic. Here we go. It's the real deal right here. It's the actual sheet. Medication guide. Do not share your Ozempic pen with other people, even if the needle. I don't give a fuck. Okay. They make sure. Excuse me. This will make it really fucking scary about Ozempic. What is the most important information I should know about Ozempic? Ozempic may cause serious side effects, including possible thyroid tumors, including cancer. Tell your healthcare provider if you get a lump or swelling in your neck, hoarseness, trouble swallowing, or shortness of breath. This may be symptoms of thyroid cancer. In studies with rodents, Ozempic and medicines that work like Ozempic cause thyroid tumors, including thyroid cancer. It is not known if Ozempic will cause thyroid tumors or a type of thyroid cancer called medullary thyroid carcinoma in people. Do not use Ozempic if you or any of your family have ever had a typical, no, had a type of thyroid cancer called medullary, I think that's what it is, thyroid carcinoma, or if you have an endocrine system condition called multiple endocrine neoplasia syndrome type 2. Child, oh my gosh. Oh my gosh. What is Ozempic? Uh, Ozempic is an injectable prescription medicine used along with diet and exercise to improve blood sugar in adults with type 2 diabetes mellitus. To reduce the risk of major cardiovascular events such as heart attack, stroke, or death in adults with type 2 diabetes mellitus with known heart disease. Okay. To reduce the risk of kidney disease, worsening kidney failure, end-stage kidney disease, and death due to cardiovascular disease in adults with type 2 diabetes mellitus or chronic kidney disease. It is not known if Ozempic is safe and effective for use for children. This is a lot going on. Just like COVID with the damn COVID shots. People was not sure if that shit was real. They just put the drug out there so fast that people was driving up in line for that shit, thinking he was going to get a cure. People was getting paid to take that shit. Why are people paying you to take a medicine? Do not use Ozempic if you or any of your family members have ever had ooh, type of thyroid cancer called. I already read that already. What's up with this, bro? They keep repeating it, and they're repeating it for the third time, bro. This is one. Hmm. You have had a serious allergic reaction to semaglutide or any of the ingredients of Ozempic. See the end of the medication guide for a complete list of ingredients in Ozempic. See what are the possible side effects of Ozempic. I don't understand what this means. Have severe problems with your stomach, such as slowed emptying of your stomach, gastroparalysis, or problems with digesting food. Lately, but I always couldn't shit. So, are scheduled to have surgery? No, I'm not using it as exactly as a healthcare provider. I'm gonna skip a week. And that'll fucking kill me. I'm sorry. I just keep reading it on. Use Ozempic one time each week on the same. No, I'm not doing that. You mean change the day of the week you use Ozempic as long as your last dose was given 2 or more days before. If you miss a dose of Ozempic, take the missed dose as soon as possible within 5 days after the missed dose. If more than 5 days have missed, skip the missed dose and take your next dose on the regularly scheduled day. That shit don't make sense. Oh, so basically telling me that I can take it and then I can do it in 2 weeks. Okay. Ozempic may be taken with or without food. Do not mix insulin. Do not mix insulin and Ozempic together in the same. Okay. Maybe. If you take too much Ozempic, call your care. Poison. Poison. The fuck is it? God is injecting our bodies. Inflammation of your pancreas, pancreatitis. Stop using Ozempic and call your healthcare provider right away if you have severe pain in your stomach area that will not go away. With or without vomiting, you may feel the pain from your abdomen to your back. Changes in vision. Tell your healthcare provider if you have changes in vision during treatment with Ozempic. Oh, Lord. Okay, here's the real shit. Low blood sugar, hypoglycemia. Your risk for getting low blood sugar may be higher if you use Ozempic with another medicine that low blood sugar can cause low blood sugar. Okay. Signs and symptoms of low blood sugar may include dizziness and lightheadedness, sweating, yes, confusion or drowsiness, headache, blurred vision, slurred speech, shakiness, fast heartbeat, anxiety, irritability, mood changes, hunger, weakness, feeling jittery. I know these feelings all too well. Dehydration leading to kidney problems. I never really looked at the side effects of this of medication until now. Like I just pop a pill because my doctor told me to take it. But this one is interesting. Stomach problems, sometimes severe, have been reported in people who use Ozempic. Tell your healthcare provider if you have stomach problems that are severe and will not go away. Serious allergic reactions. Stop using Ozempic. If you have any of the symptoms, swelling in the face, lip, tongue, problems breathing and swollen, severe rash and itchy, fainting and feeling dizzy, very rapid heartbeat. I mean, goddamn. Gallbladder problems, veiny upper stomach, yellowing of the skin or jaundice, clay color stools, fever.